In this video, we will discuss about one of the strategy that has been used or that is been used or will be used in future for treatment of spinal muscular atrophy. And one of the drugs that is recently been approved based on this therapy is uh, nu- Nusi, Nusinersen or Spy, Spinaraza drug. So let us first understand how this antisense oligonucleotide therapy works. So we will compare this approach by comparing the situation in a patient and a healthy individual. So in the healthy individual, this SMN1 gene is functional. This SMN1 gene is functional. It will leads to production of active protein, whereas the SMN2 gene, there is a change in seventh position of sixth position of exon 7 from C to T that leads to uh, deletion of exon 7 in the mRNA, and which leads to unstable protein formation. And in SMA patient, or in the patients that are affected with spinal muscular atrophy, this SMN1 gene is not functional, whereas this uh, SMN2 gene works similar to that SMN2 gene works in healthy individual. And the final production of correct SMN uh, uh, active protein, final production of active protein because of SMN1 gene is very less, as only 10% of the proteins that are produced from SMN2 gene will be functional and active. So in this ASO approach, what happens is that since this problem in SMN2 gene problem occurs in during the splicing process, so in order to avoid or suppress this, in order to suppress the uh, exon 7 splicing, this antisense oligonucleotides is added at the end of this seventh exon. This prevents the avoidance of splicing of exon 7. So because of this, the final mRNA will include exon 7, and the final production of protein from this mRNA will leads to active protein formation. So this is how this ASO technology works. That is, it prevents the splicing of this exon 7 from SMN2 gene, and this thing is expressed in detailed figure or similar figure in the right side. That is, in case of normal person, this SMN1, in SMN1 the sixth position in exon 7 is cytosine, and this leads to correct mRNA formation and functional protein formation. Whereas in SMN2 gene, what happens is that instead of C, it is U that is formed in pre-mRNA, or we can say T is translated to, as in mRNA, we have U instead of T, uracil instead of tyrosine. So this U will prevent the splicing of this mRNA into the final product. So because of this, it leads to a unstable non-oligomerized truncated SMN protein. And what happens in the antisense therapy of spinal muscular atrophy is that this antisense oligonucleotide is added at the end of this uh, seventh exon. This will prevent the this will prevent the avoidance of this exon 7 into the uh, final mRNA, and with the addition of inclusion of this seventh exon in the final mRNA for that is used for protein coding, this leads to the formation of full length SMN protein that is functional. And a drug that is been approved to do this thing is Nusinersen. However, it is not. However, this thing is still under investigation. And this study about antisense oligonucleotide therapy has been done on mouse. So when this oligonucleotide is inserted into the intracerebral ventricular injection, or we can say into the fluid that surround the tissues around the brain, or fluids that surrounds the brain, we can say in simple words. So this leads to striking increase in SMN in the central nervous system alone. So, and the overall effect is that the median survival of this mouse is increased. However, it is increased by a factor that is slightly less than 2. And when these antisense oligonucleotides are injected into the subcutaneous shears injection, as it means it is injected into the skin, then it leads to the increase in SMN in different parts of the body, such as heart, central nervous system, muscle, and other organ. And this leads to overall increase in the median of survival by a factor of 25. So in the mouse, it shows that antisense oligonucleotide therapy works pretty well. So it is expected that this therapy might works well in the humans. However, the final results are yet to be come out. But this result shows that soon antisense oligonucleotide therapy might overcome gene therapy, where the problem arises is the deletion of exon in the final mRNA formation or similar, or problem arises related to splicing of the exon. Yeah, so I hope you have understood something about this antisense oligonucleotide therapy and how it works in spinal muscular atrophy treatment. If you need to understand this thing in detail, you can go through the references that has been provided in the description. That's all for this video. Thank you for your time.